Hello everyone, my name is Zarina Severing. I am an Indiana State University nursing student. This is a health education program project that I am completing for community health nursing. Today, I will be discussing the most common forms of bacterial meningitis that are found in the United States. Who is most at risk? Our population at risk, also known as the PAR, are adolescents and adults between the ages of 15 and 22 years old who plan to attend college. The objectives that we hope to meet during this presentation are for you to gain a basic understanding of the etiology of bacterial meningitis, gain an understanding of how bacterial meningitis is transmitted, gain an understanding of the signs, symptoms, and diagnosis of bacterial meningitis. Also, we'd like you to gain an understanding of how bacterial meningitis is treated and know what steps should be taken in order to prevent bacterial meningitis. Please note, there are attached links that contain an outline of this information, a pre-test, a post-test, and an answer key. At this time, I would like you to please pause the video and complete the pre-test. Okay, we're back. Thank you for taking the time to complete the pre-test. When we speak of etiology, what do we mean? Etiology means the cause of a disease. It's what we want to know. What causes it? Bacterial meningitis is a form of meningitis that infects the lining that surrounds the brain and spinal cord. What causes it? In the United States, bacterial meningitis is usually caused by one of 5 bacteria: Streptococcus pneumoniae, Group B Streptococcus, Neisseria meningitis, Haemophilus influenzae, Listeria monocytogenes. The most common cause of bacterial meningitis in teens and young adults, which is the PAR that we are discussing, are Neisseria meningitis and Streptococcus pneumoniae. These bacteria live in the mucus of the nasal passages and on the back of the throat and can cause development of meningitis types A, B, C, W, and Y. So who's at risk? Meningitis A, B, C, W, and Y is most commonly affected in teens and young adults that range in age between 15 and 22 years old. The risk of infection is higher for those who fall within this age range and are attending college and living in dormitories on campus. Other factors that can increase a person's risk for contracting bacterial meningitis are having a previous viral infection, living in a crowded household, being exposed to cigarette smoke, or having an underlying chronic illness. So how do you get it? The bacteria are transmitted from person to person through droplets of throat and respiratory secretions. The droplets come from the carrier, which is the person that has the disease already. People that are simply carriers have the bacteria present in their body, yet they do not have an active case of bacterial meningitis. The bacteria that causes the bacterial meningitis can be transmitted through sneezing, coughing, kissing, or living in close quarters with an individual who is a carrier. So what are the signs and symptoms? Some of the most common signs and symptoms of bacterial meningitis are similar to flu symptoms and include high fever, stiff neck, headache, vomiting, confusion, and sensitivity to light. Diagnosis of bacterial meningitis is confirmed by presence of signs and symptoms, and then through subsequent lumbar puncture, also known as a spinal tap, that yields a cloudy, purulent spinal fluid that is tested and confirmed to have the disease-causing bacteria present. So if it's present, what do we do to treat it? Bacterial meningitis is treated through use of intravenous antibiotics. The antibiotics that are most commonly used in the treatment of bacterial meningitis are ampicillin, ceftriaxone, and penicillin. Bacterial meningitis can be deadly. Death can occur within hours to days of contracting it. So it's extremely important that all flu-like signs and symptoms are taken seriously. If treated quickly, most people recover from meningitis. Unfortunately, brain damage, learning disabilities, and hearing loss are some of the more common permanent disabilities that can occur as a result of the infection. So, what about prevention? Is there a way to prevent a person from getting meningitis A, B, C, W, and Y? Yes, there are vaccines that can prevent type A, B, C, W, and Y meningitis. Meningitis type A, C, W, and Y are prevented by getting one of 3 vaccines, and there are 2 different vaccines available to prevent meningitis B. Available meningitis A, C, W, and Y vaccines by trade name are Menimmune, Menactra, and Menveo. Available meningitis B vaccines by trade name are Trumenba and Bacterial. In fact, due to the nature of dormitory living, most states, 37 out of 50 states in fact, require college students to provide proof of meningitis A, C, W, and Y vaccination before allowing them to enroll and attend classes at the university. So some side effects could be caused with the vaccine, but they should resolve within 7 days. These reactions or side effects include muscle or joint pain, headache, nausea, diarrhea, fever or chills, tiredness or fatigue, soreness, redness, or swelling at the injection site. People that should not get these vaccines are people who have had severe allergic reaction to the vaccine in the past and women who are pregnant or breastfeeding. Hopefully you've gained a bit more knowledge on the bacterial meningitis disease. Now you can take some time and take the post-test.